Hi, everyone. My name is Jose Corona,
And I'm Kelsey Eskew.
and today we will be addressing the State Public Health Panel board members. And we wanted to discuss advocating for the expansion of the dental school based healthcare system that we have going on at Van Buren and Highland High School and implementing dental hygienists into the schools. So today we'll be discussing why this low income schools should have this kind of program, how the hygienist will play a role in it, the benefit to the students and the parents, and the funds for acquiring and starting this program. So let's begin.
The need for the program expansion is very large. There is a large portion of the student population in our schools that we don't reach, unfortunately. May not, due to things like not having adequate access to insurance, maybe undocumentation or other circumstances have gotten in the way of this.
There's also a lot of parents that can't financially provide for the oral health of their children. Some of them might be single parents, working two jobs, and they just can't, they barely make ends meet at the end of the month, and they just don't have that extra income to provide for their children's health care, especially if they don't have insurance. And actually, from a study from an article from the New Mexico Department of Health, we found an interesting statement that said the percentage of children and adolescents aged 5 to 19 years with untreated tooth decay is twice as high for those from low-income families in comparison to children from higher-income households. And I thought that was a, a good comparison as to why we should be reaching those socioeconomic struggling schools first.
Yes, and then there's access such as not only just insurance, but access to driving. They may not have a car, they may not be able to get to a dental office, and parents can't always take off work. This is a big barrier to our children at these schools.
And another big barrier is also cognitive. A lot of students and parents aren't aware of the importance of dental care. Sadly, they may lack the proper education in oral hygiene, and a lot of students and parents don't even know what a hygienist is and how important we play a role in the public's overall health care.
And there are a lot of benefits to public health from doing this. We're especially to adolescents in their development. They're going through a time where their hormones are changing. They may have high plaque, bad breath, a lot of differences in decay that may be untreated. These are things that we definitely want to get with them and make sure we can provide that therapy. The mouth, again, is the window to the rest of your body, often serving as a helpful vantage point for detecting the early signs and symptoms of systemic disease. So taking care of your mouth, teeth, and gums is worthy goal in and of itself. Good oral and dental hygiene can help prevent bad breath, tooth decay, and gum disease.
So not only would the school youth be receiving adequate oral health care, education, and aids, they would be receiving treatment at the schools. They would also be receiving education through personalized interaction, specific to their needs, and also in the classroom we'd be giving presentations. And they'd also receive oral hygiene aids such as toothbrushes, toothpaste, floss, because especially when you're dealing with low socioeconomic schools, sometimes those are things that for one person it's like not too it's affordable, they could buy it, and for other people they may be struggling that's even a difficulty to buy.
Yes, there are a lot of issues with that, maybe not even owning a toothbrush. And again, we also don't only just want to speak to the children at the schools, but we also want to speak to the parents, and so they can receive education. That way, they know about their children and what's going on, and they can implement that in their households. This could also be a very great financial benefit for the parents, especially if they cannot afford for dental care otherwise.
And so we're going to discuss, how does a hygienist play a role in these programs? Well, by implementing a hygienist into the schools, um, the hygienist then has the knowledge, experience, and the licensure to do screenings on students to see if they possibly need restorative care. If they they could possibly have some demineralization that could be leading to a cavity, at which point we would be able to refer them to partnering dentists. For example, right now we're partnering with Camino a Salud, which is through UNM, and they're a dental clinic, and they've been partnering with us to provide restorative care to those students who possibly need it. They could come in and do diagnosis, and then do one day where we just bus all the students who need the restorative care from their schools over to the clinic, and they'll be able to implement perform restorative care. And if this program expands, we could also expand with other clinics who would be willing to do the same thing.
Yes, that's been a great thing for Van Buren and Highland High School so far. They also do provide fluoride treatment, sealants, and cleanings or prophies, which is a great therapy. We would like to do that as well, making sure when we do provide fluoride, it's helping with the teeth and fighting decay. Sealants are always very good as well, and they're cleanings every 6 months.
And how we discussed about education, not only will we be performing oral hygiene instruction specifically to students we're treating in the chair at that moment, we will also be giving classroom presentations. That way we reach even those who aren't participating with our program. We will be able to reach them and educate them. We will also be giving education presentations to the faculty, the staff, and also maybe hold a presentation for the parents to come and, learn about proper oral health care, ways they could access it if they're struggling financially. So it would be beneficial not only to the students, the faculty, and the parents as well.
Again, you may be wondering, how are we going to do this? And that's the financial portion. We will, after this is approved, we can apply for grants, also speak to state and private donations, and see if we can get sponsorships. Right now, with the current Van Buren and Highland, they were able to get a grant that was covering this and providing this amazing therapy to these students that otherwise would not be able to.
So in conclusion, today we discussed, reasons for this program expansion to other, low socioeconomic schools, the benefits that they could really be to the public health overall, especially adolescents, the dental hygiene role in these schools, and the financial aspect.
Ultimately, we just want to bring dental hygiene to these students. We want to go off honoring Dr. Phone's original belief, bringing oral health to the public. Thank you again for listening to us, and we hope you approve.
Thank you.